Thank you, Nat, and thank you very much for the invitation to be here. It is my great privilege and pleasure. I'm following guinea pigs on a ramp. I've been told not to get the floor squeaking and to be close to the microphone, so I'll try and concentrate. So I'm here to talk to you about what is a good life for animals. I'd like to begin just to acknowledge and pay our respects to the Kaurna people, who are the traditional custodians on the land that I work on, and acknowledge the deep feelings of attachment and relationship of the Kaurna and other First Nations people to country, and respect and value their past, present and ongoing connection to the land and cultural beliefs. So, a good life for animals. This is my dearly beloved Fergus, who died when he was 10, but this is him early morning on the beach, and I can guarantee that that moment of time he has very high happiness, welfare and quality of life. But before I talk a bit more about them, what's in a name? So animal happiness can be defined according to Yates and Main in three ways. So it's the everyday sensations that they experience. It's how they engage with their environment, their conspecifics and also their handlers. And it's also them realising their own goals, which are usually motivation. When you have a Labrador, usually involves food, but whatever else they're motivated to behave towards. When we talk about animal welfare, it's more often a longer term time period. It includes both physical and psychological health, as well as in traditional definitions an animal's ability to cope. Animal quality of life is used more often clinically with validated scales, and especially in relation to end of life or serious illness when you're making decisions about when it's the right time for euthanasia. Quality of life does integrate multiple domains, including physical and psychological, but often the measures that are used, the validated ones, do focus more on physical than psychological health, as this is easier to assess in animals. So in simple terms, a good life for animals is when they have more positive than negative experiences or emotions. All animals, including humans, behave in a way that we optimise our positives every day and we minimise the negatives. And if we get that balance right, we can think we have a good life and animals have a good life. But do they need to be happy all of the time? If you look on social media, there's often an emphasis on short-term happiness. There are more thoughtful responses though, like this blog that points out happiness isn't a destination, but is a state of mind, that you don't need to be in every moment of every day. Ups and downs happen without us even aiming for them, and this is healthy. How can we learn to deal with challenges and develop resilience without some downs? In the same way, I think, we shouldn't expect that our companion animals will always be happy. So if we're not talking about shorter-term happiness, what are the other ways we can think about measuring animal welfare? And the 5 domains developed here in New Zealand by David Mellor and then extended with updated versions by Kate Littlewood and others is a way that we can think of it. So it's a widely used model now based on the original 5 freedoms, with the advantage of really focusing on the positives rather than just removing the negatives. It includes nutrition, the environment, health and behavioural interactions, and these in turn will all impact on the mental state of the animal. So for example, if an animal has a poor diet, they'll be hungry. Each domain can be measured, and sometimes that mental state can be inferred from those other domains. So let's have a look at other ways that we can measure what an animal is experiencing in the here and now. So don't be scared by this figure. It's from one of my PhD students, now graduated, Petra Edwards, also a dog trainer. Petra's PhD looked at how veterinary visits can cause distress in some dogs. In this study, dogs had continuous heart rate measures. So on the x-axis there, you can see time, and on the y-axis is the heart rate in beats per minute. So dogs went through a mock clinical exam in a completely neutral room, so it's not like they were in a vet room where they were exposed to smells and things that would trigger them. As a proxy for the mental state, we measured the heart rate. The top line is actually a greyhound. The bottom line is a border collie, and both dogs were around 5 years of age. They couldn't have had severe anxiety in visiting a vet, having a physical exam to be recruited into this study. The boxes with letters at the top are the stage of the clinical exam. So you can see there it goes from habituation and then the right front leg being examined right through to a mock vaccination. So the thing that might stand out to you immediately is that there's a clear separation between those two lines, and the greyhound at the top has a much higher heart rate at pretty much all times than the border collie. It actually peaks at well over 200 beats per minute. And remember, this is a dog which is stationary. The dog actually didn't show obvious signs of distress, and the behavioural signs were not that obvious in picking up which dogs had heart rates like this one and which dogs were doing a bit more comfortably. Heart rate does measure valence rather than necessarily it being positive and negative, but in the context of all of the other behaviours and things this dog was showing, we believe that it was showing very negative effect with these heart rate peaks. It wasn't having a positive experience at all. But if we didn't have that heart rate data, we wouldn't know just how negative it was. So we can see that proxies like heart rate can inform us about what the animal is actually experiencing. That mental state is always the thing that's hardest for us to really assess. But could we use the 5 domains model to develop a checklist for guardians to be able to assess welfare? Well, I asked my first year students that last year. So I teach across all 4 programs in our school, around 180 students. They did this in groups as a major group assignment, and they developed checklists for dogs or cats which were based on the 5 domains. And this is a table, so they separated them up, and this one includes the behavioural interactions. And they've actually assessed that this included interactions with enrichment, interactions with other animals, and interactions with humans. So you can see at the bottom is a table where they've tried to use it as a checklist, and you can see those parameters. And then they've tried to measure it from 1 to 5, where 1 is attempting to attack the target and 5 is approaching or playing with the target. But of course, at the lower level, there might also be a complete lack of interest or fear of the target, and not all dogs will attack. So they've made an attempt at trying to measure it, but probably it's more complex than what they've got in here. So some of the more thoughtful teams did include training in the behavioural interactions domain. Here you can see how another group described this, with effective training including positive reinforcement, clear communication, patience and consistency, and ineffective or unethical training included fear and anxiety, physical harm, decreased trust, etc. So this group actually displayed a clear and detailed understanding of what good and bad might mean in this domain. In their checklist, they described here, you can see the target, they hit it. The top level of appropriate training techniques included gentle, calm methods used, no flight, fight or freeze responses, no evidence of fear, and a trainer who prioritises the welfare and comfort of the dog. So really well done in describing what this would look like. But translating this into an easy-to-use checklist that could be done quickly by a guardian to work out if their pets have a good life was not straightforward, as the students learned. So here are comments from students in their final reflective reports. So the task proved much more difficult than I had anticipating, raising questions like, how do you quantitatively measure emotion and affective state? And how can we numerically weigh one requirement against another? Even if they could come up with a scoring system that was clear and objective for each element in the checklist, which was not easily done, they saw that how could they use this to obtain an overall measure and decide if that animal had a positive or negative state of welfare or even a good life. And while the domain of behavioural interactions was harder for them to score than something like body condition score, they really struggled to work out how to score mental state. But even with these constraints, students did see how much they had learned. So you can see at the bottom, the biggest thing I learned was an increased appreciation for the welfare of my own dog. They realised the importance of enrichment, avoiding conflict, and all of the other factors included in the 5 domains, and recognised behavioural issues such as separation anxiety can be a sign of negative welfare. So even when these students were not coming up with a checklist that guardians could easily use, possibly providing guardians with a checklist like this might see a little bit more encompassing view of what might cause bad welfare and allow good welfare. So what if we think more about whether some areas are more important than others? So those were the 5 domains. Don't be scared by these. It's Maslow's hierarchy of needs, which some of you might recognise, which has been used as a conceptual model to indicate we have essential needs such as food and shelter and safety. But satisfying these isn't enough for a good life. We also need a sense of belonging, self-esteem and respect from others. And at that highest level, self-actualisation with creativity. So Griffin et al., you can see the citation there, have tried to translate this to what it would look like in a dog using a Delphi approach, interviewing experts. So you can see at the bottom are the physiological and safety needs with some of these detailed. Rather than belonging being the next level, they call it social needs, and rather than esteem, they call them integrity needs, which they define as positive training and behavioural support. At the top, they change self-actualisation to cognitive needs, satisfied with cognitive stimulation. Like a lot of things that humans do, they think of it as a linear hierarchy, but is it really? So Maslow's model is not necessarily a simple ladder. A couple of examples from human papers. In a longitudinal study of adolescents with depressive symptoms, feelings of family connectedness and control were more important to them in reducing symptoms than general family stresses and neighbourhood safety, which are at a lower level of Maslow's hierarchy. And in another study where they were looking at sustainability and well-being in people, they found that love and belonging and esteem were rated much more highly than self-actualisation, which is supposedly at the top of the pyramid. So not linear, but it gives us a little bit of an idea about what priorities might be. And for companion animals, I suspect that love and belonging might be the most important, but this is my best guess. And I'm not actually sure how you would even design a study to do that, as it's more an ethical question. So Griffin's interpretation did include positive training in the integrity needs of the dog, but I think it's central to all components. So it provides cognitive stimulation, it provides a feeling of agency and safety if it's done appropriately, it provides social contact and support, it gives cognitive stimulation, and if it's not done right and aversive methods are used, then it will have a very serious effect on physiology, which will then have a compounding effect on all of those other parts of the pyramid. So zooming out one more level, so we started with the 5 domains, we then looked at Maslow's hierarchy. Now I'm going to zoom out to a one welfare approach, which has already been mentioned. And I've used it because I don't know that we can look at a good life and animal welfare in isolation without the rest of that ecosystem. When we optimise benefits to all, we see improved welfare. So Julia Henning, who's just finishing her PhD with me, has used a quantitative survey to measure play behaviour in cats and how it's linked to their quality of life. So Julia found that cats that had higher quality of life scores were more playful. Their guardians offered a greater variety of games. So it wasn't about how long they played, it was the variety of games that were shown. If they were housed indoors versus outdoors, and there was a closer cat-guardian relationship. Another example from another PhD student, Anna Costa, who's looked at welfare in puppies and how it affects their guardian. She has done qualitative interviews, and these are the themes that Anna interpreted from people who'd recently brought home a puppy. So in the most enjoyable was the process in which they got to know their puppy and they became part of their family. So eudaimonic happiness, there's the word happiness again, is happiness derived from a sense of meaning or purpose in raising the puppy, which people talked about a lot. Most helpful was support in training and socialisation. It really was a village to bring up a puppy, so they drew heavily on friends and family, material or physical things such as being able to take time off work and having realistic expectations of how hard it would actually be. Most challenging, interestingly, was getting training right and dealing with puppy behaviours and the pressure of being a good guardian. So what does that look like for people? And you can see here some of the comments that people have made in Anna's PhD. So trying to get him to be home alone, not being able to duck to the grocery store for fear of him barking and crying. It's tiring, knowing what to do to prevent long-term serious harms, inability to do the things I wanted to do with my puppy due to his behaviour, and finding the balance between puppy, husband, house, cleanliness and family. Good luck with that. So raising a puppy is really hard for some people. The term puppy blues has been coined, and prioritising the welfare of the puppy over the welfare of their guardian is not going to give us the best outcome for either. But I've put there at the bottom that even with all of these negatives, the overwhelming experience for the majority of people is positive. But for the minority of these, it's bad enough that they might actually give up their puppy, and it has a really serious effect on their own mental health. So speaking of mental health, Tracy Taylor, who's now doing a PhD with me, in her honours looked at the experiences of guardians who looked after older dogs, focusing on doggy dementia. Burden of care is the cost of caring, and a scale used in human caregivers. It's been also validated for use in animal carers and called the Sarrett burden of care. So on this figure here, you can see across the bottom is that burden of care score. Higher is bad, and the frequency is on the left. And the cutoff point for an increased burden is there at 17. So you can see around 16% of these guardians have a clinically significant burden of care, which means that is going to be affecting their physical and psychological health. So most people are on the left of the line, but we need to be aware of them on the right of the line, and this was recently published in the Vet Record. People don't begrudge their dogs. They will do everything that they can for their dogs. And this is a beautiful slide that also comes from Tracy's study and really spoke to the heart of that study. So they don't begrudge them. They love their dogs. They will do whatever they can for them. But we've got to support the people as well, because if their welfare isn't looked after and they break, how can we look after their animals? So I'm going to zoom out one more time into social determinants of health. And this is Sonia McDowell, who's doing a PhD with Tiffany Howell at La Trobe, and I'm co-supervising. I have a background in public health, and I'd been interested in this for a little while. The principle of the social determinants of health is that each factor has an impact on the welfare of a person. So depending on, especially when they grow up, what the level and quality of their education is, what their access is to healthcare, what their neighbourhood looks like, their social and community links, and finally their economic stability, that these will all have an association with their mortality and also their morbidity. So if you measure all of these and then measure mortality rates, the lower levels, it's not the people's fault, it's what they're born with, the resources they have will have higher morbidity, higher mortality and less opportunity. So what we've done is we've translated that impact on the humans to what's that going to look like for the animals. And Sonia's investigating this. So for example, if people live surrounded by freeways without parks, it's going to be a lot more difficult for them to take their dog out for walks, and their neighbourhood may not be even safe to go out at night. They may also not have time to work because they've got 2 jobs. There may be a lack of veterinarians and positive dog trainers, even rescue organisations from what we saw earlier in the area in which they live. Why is this important? If we judge how people look after their animals through the lens of those who have higher levels of social determinants, then we may label them as bad owners when they're doing their best that they can under difficult circumstances, and where we really need to support that human-animal bond. So I would like to finish quickly. I think I've really whizzed through it because I was concerned with time, but I'm okay with time. I'm not? 1 minute, okay. This is really quick. I thought that this might be interesting to the audience here. I'm on the Dog and Cat Management Board in South Australia, and one of the things that will really impact negatively on dog welfare is if they're involved in a dog bite. It's bad for the dogs, it's bad for the owners. So we've been running a public awareness campaign where it's also been on bus shelters and on the back of buses. We did that last year. We'll be following up with more focused advice this year. And we did pre-surveys and post-surveys around people's attitudes, and I'm just analysing that data as well. We're seeing some really interesting and significant changes, and we can also benchmark them. So bringing it all together, We don't want to prioritise human welfare over our pet welfare at any time, but then we don't want to prioritise our companion animal welfare over human welfare, because it's not going to be a good outcome for anyone. So we really need to think about this ecosystem approach. And it's not a simple one, because it's incredibly complex to be able to do research into. But as disparities in the world are increasing, we are at risk of having a two-tier system of having companion animals, the haves and the have-nots. And we need to work really hard not only to ensure a good life for companion animals, but a good life for all. Thank you.
Thank you very much, Susan. That was a lot of information and you went through it beautifully. We do have time for a small question for Susan, if there's one burning question out there.
That's our happy place on a
So I've got a burning question, just very briefly. So you talked about the perception of guardians at one point in relation to them thinking that when the animal was showing a lot of play, or they were interacting with them a lot, or there was quite a lot of positive activity, that they would perceive that the quality of the animal's life was high. So I just wanted a quick comment about that, because in some of our surveys that we run around a good life, people assume that because they love their animal and that they're interacting with their animal, that the animal must be having a good quality of life.
Yeah, and that's, you've noticed that. So that was a cross-sectional survey, and it was the people's interpretation of quality of life. And we can't be sure that if we asked the cats, that it would be the same thing. The only thing I would say about that, the quality of life measure might be subjective, but the play measures probably not, because I don't think anyone could force a cat to play, and if they did, they would end up really severely damaged.
Oh, well, thank you very much.